Assalamualaikum and hi everyone. My name is Nurul Shamimi binti Abdullah and my matrix number is 2019-255-632. Today, I'm going to share a bit information about dengue cases in Malaysia. Before we go further, let me tell you guys a bit information on what is dengue. Dengue fever have been known to be endemic and reportable disease in Malaysia since 1971. Major outbreaks occurred in 1973, 1982 and in 1998. For the past few decades until now, many studies have been performed to investigate the importance of this disease in Malaysia. In 1982, Malaysia experienced the worst dengue fever outbreak in its history. All states in Peninsular and East Malaysia were similarly affected. There were a total of 3,005 cases with 35 deaths, with the majority of cases occurring between the months of July to October. Most cases occurred in patients above 12 years old. The majority of them were Malay males. First subtopic is symptoms. Many people experience no signs or no symptoms of a dengue infection. When symptoms do occur, they may be mistaken for other illnesses such as flu. It usually begins 4 to 10 days after you are bitten by an infected mosquito. Dengue fever causes a high fever which can reach 40 Celsius and any of the following signs and symptoms such as headache, nausea, vomiting, muscle, bone or joint pain, rash or swollen glands. Most people recover within a week, but in some cases, symptoms worsen and become life-threatening. This is called severe dengue, dengue hemorrhagic fever, and dengue shock syndrome. Next is factors. Dengue fever is caused by any one of 4 types of dengue viruses. You can't get dengue fever from being around an infected person. Instead, dengue fever is spread through mosquito bites. You have a greater risk of developing dengue fever or more severe form of disease if there is rainfall, maximum relative humidity or high temperature. Secondly, if you had dengue fever in the past, this is due to previous infection with a dengue fever, which increase your risk of severe symptoms if you get dengue fever again. Besides, if you live or travel in tropical areas, it actually increases your risk of exposure to the virus that causes dengue fever. Let's move on to the next one, which is complications. Severe dengue fever can cause internal bleeding and organ damage. Blood pressure can drop to dangerous levels, which causing shock. In some cases, severe dengue can lead to death. Women who get dengue fever during pregnancy may be able to spread the virus to the baby during childbirth. Additionally, babies of women who get dengue fever during pregnancy have a higher risk of preterm birth, low birth weight, or fetal distress. So now I'm going to share a few tips on how to prevent ourselves from getting dengue viruses. First of all, stay in air-conditioned or well-screening house. The mosquito that carries dengue virus are most active from dawn to dusk, but they can also bite at night. Second, wear protective clothing. When you go into mosquito-infected area, wear a long-sleeve shirt, long pants, socks, and shoes. Next, use mosquito repellent. Permethrin can be applied to your clothing, shoes, camping gear, and bed netting. You can also buy clothing made with permethrin already in it. For your skin, use a repellent containing at least a 10% concentration of DEET. Last but not least is reduce the mosquito habitat. The mosquito that carries the dengue viruses typically live in and around houses, breeding in standing water that can collect in such a thing as used automobile tires. You can help lower mosquito populations by eliminating habitats where they lay their eggs. At least once a week, empty and clean container that hold standing water such as planting containers, animal dishes and flower vases. I think that's all from me. Thank you for watching and have a nice day.